When you hear the term CPR, do you think, as many of us do, that's a life-saving technique I should know but would never be able to remember? Well, if the answer is yes, our next guest can help you by introducing us to a new and easier way to learn CPR. New guidelines just released by the American Heart Association. He is Philip Freed, Chief of Cardiovascular Services at Lenox Hill Hospital in New York, and one of the CPR instructors involved in revising those guidelines. Thanks very much for being with us.
Thank you, Mika.
So why change the guidelines, first of all?
Well, we realized that people were getting a little confused. Problems were happening where, if you think of your average neighbor trying to do CPR, first time ever doing it, there'd be confusion or panic, and we need to make the protocols easier. We need to make it easier to understand how to perform CPR to better survivable outcomes for patients.
Let's look at some of the changes. The first one I think is fascinating because in some cases I think you don't need it. You can clarify for me. You don't have to take a pulse.
That's right.
And they also streamline the chest compression and breath ratio. Why don't you take us through these? I actually don't have this here, but you can read it on the screen.
It's okay. Looking on the screen, what we've done with the chest and compression ratios, first of all, we used to say for 1 or 2 people doing CPR on a downed individual. What we say now is we had different ratios. We're keeping a standardized ratio of 2 breaths to 15 compressions, whether it's 1 or 2 people involved in the rescue. Second, what we've done is we've realized that 35% of people cannot find a pulse. I mean, can you find yours all the time?
No, often I cannot, even when I'm trying to work out. And often I'm someone else in a state of panic when you're trying to help them. Finding a pulse is very difficult.
Exactly. So what we said is look for the obvious. Is the patient moving? Is the victim breathing? Is he showing any signs of life when you stimulate him? Any coughing or any type of motion? If there's any of that, you obviously have to realize the patient will have some sort of heart rhythm. So instead of looking for a pulse check and wasting needless time when you could be doing compressions to save someone's life, take out the unnecessary steps and work on the compressions to give more circulation to the body.
Now these guidelines, when you look into them or you go to a class, are much easier to learn and to remember, and it also brings in a big way, the introduction of these AEDs, which we're going to be seeing a lot more of in public places, are we not?
Absolutely. Right now, if you walk through O'Hare Airport, this module right here, which is the most common one on the market, this module right here is 1 minute apart from anywhere you walk in O'Hare Airport. They're in little pull-down boxes. The minute you pull this out, it automatically sends for the ambulance and the paramedics, and this device here can save someone's life. Simply what you do, and Mika, I'm just going to show, actually, you're going to show how.
I'm going to show you, okay.
As you see, I've already put the pads on for you, and this is what the pads look like. And as you see, the pads show you with body symbols on there exactly where to place the pads on the pads themselves. So here we've placed the pads for you, and basically the machine talks you through everything to do. So if you look at the machine, push the number 1 where it says power, and that turns it on.
Apply pads to patient's bare chest.
We've done that.
Plug in pads connector next to flashing light.
Plug it in for me.
All right.
Push it nice and hard.
Analyzing heart rhythm.
Now it's going to analyze to see if the patient has a pulse. Don't touch the patient. The machine cannot handle if you're shaking or moving the patient. It can interpret the rhythm wrong. So let the patient be left alone for a minute.
Shock advised.
And it tells you shock advised. You know your patient doesn't have a pulse. Which button on here do you think shocks the patient?
Right here.
So when you start blinking, just yell, everybody stand back, and then press the button.
All right, Ashley, Gina, stand back. Here we go.
Press the button.
Shock delivered.
And you've just shocked the patient.
Unbelievable.
Now the machine will tell you if it worked or not. It's going to analyze again.
Do not touch the patient.
And it tells you it's safe to touch the patient. That means the patient has been converted back to a rhythm, or that they have a rhythm that still requires CPR, and it'll bring you into those steps.
Heart rhythm.
Now that is easy to use.
How easy was that for you?
That was very easy.
So just on this, in a few minutes, we've already taught you how to save someone's life with a defibrillator. And in a short amount of time, we can teach you with the new guidelines of CPR that American Heart's taken the boldest move ever, how to do CPR in a short amount of time and save people's lives.
There are many places you can learn CPR as well.
Anywhere. You can call the American Heart Association. They have places set up in every state, and now they've gone international, and almost every country is covered.
Philip Freed, thanks very much for coming in. Fascinating.
Mika, thank you very much.
Ashley, Gina, to you.